Okay, so today we'll be looking at one of the recent questions that have been asked in INICET May 2026, as also it was a repeat question in INICET 2021. It is on nicotine. So the question, as we can see over here, is uh, which of the following is true regarding nicotine substitution therapy? Okay, so first is preferably given by gastrointestinal route. Second is varenicline comes with a black box warning of cardiovascular death. So option C is there should be a 15-minute gap between nicotine gum and the coffee soda acidic food as the decreases its absorption. Number 4 is nicotine chewing gum is better for constant use. It is gives 25% higher blood level than lozenges. Okay. So if you think for a while, they're all asking about different properties of nicotine and how nicotine interacts with our body. Okay, there are questions mainly regarding of side effects of nicotine, like in the B, as well as pharmacokinetics of nicotine all over. Okay, so the answer which will be correct in this case would be our option C. So there should be a 15-minute gap as they decrease its absorption. So why is this 15-minute gap needed? So the answer lies over here. So any acidic fruit, it's not just tea, it can be orange juice, it can be coffee, tea, any acidic thing will create a barrier. It literally acts like a bouncer. So for the nicotine to get absorbed across our buccal membrane, which is a GI membrane, it needs an alkaline medium, which is usually provided by our saliva. Okay, as soon as we take this acidic drinks, the local pH also becomes acidic, and there is a law against which the nicotine cannot go through. Okay, so we can see that the acidic drinks are actually acting as a biological bouncer. So that's why we should avoid it for 15 minutes prior to or during the use of nicotine gum lozenges or inhalers. Okay, you can see these are some of the textbooks that I've quoted, but also talks about like Kaplan Sedok talks about consumption of 15 minutes, a 15-minute gap prior to and during use, as well as Tasman also talks about the same acidic substances. Okay, so this is the correct answer, but let's look at the wrong answers as well. Okay, so why was A a wrong answer? So why just not prescribe a nicotine pill? The answer lies if it goes to the esophagus tube, it directly gets destroyed and decimated by our liver. Okay, so nicotine undergoes extensive fast pass metabolism. So liver destroys the compound ever even reaching our brain. That's why we need some alternate routes like buccal and transdermal. So that's why through the skin, either placing a sticker like thing that is transdermal or by keeping it over here in our mouth and not actually take using it as a pill, it reaches our brain by directly crossing the blood brain barrier, by directly crossing our blood gut mucosa barrier. Okay, so we never actually just swallow the nicotine gum like a or nicotine lozenges like a pill. Okay, this also quoted the same in Kaplan Sadok. Why is this B option? That why is this incorrect? Now the answer lies in the uh, the fact that varenicline never had any black box warning regarding heart. It was the old FDA warning was regarding neuropsychiatric manifestations. Okay, so the neuropsychiatric manifestations was removed in 2016 thanks to the Eagle study, after which the FDA black box warning for neuropsychiatric events were removed. So earlier, what happened was the FDA gave us a black box warning. Whoever for in whom we are using varenicline, we have to observe for certain neuropsychiatric symptoms like behavior changes, hostility, agitation, depression, or suicidality, because it was hypothesized that varenicline can exacerbate these symptoms which because of the Eagle study, once again I'm highlighting the Eagle study, this black box was removed and there is no neuropsychiatry related black box warning on varenicline right now. Okay, so that was an hypothesis which has been disapproved by the Eagle study. Okay, and lastly, why was this D option wrong? Okay, those D option is actually the opposite. If we look at uh, the graph over here, so it is this nicotine lozenge that is achieving a higher 25-27% higher blood concentrations than the nicotine gums. So the lozenges are appearing higher than the lozenges are achieving higher blood level than the gums, which is the exact opposite. Okay, in the question it was told as the gum is better. Okay, gum giving better, but in reality it was the lozenges which was better. Okay, the same we can also see over here, both quoted in Tasman and Kaplan Sadov. Okay, so this was regarding the question. Another extra pearl I'd like to give is regarding the chew and part technique. Okay, this is often associated with the pharmacokinetics as well. So on the left, we can see how not to use the nicotine gum. Okay, so we don't just chew it, okay, because all the saliva once again washes the nicotine into the GI tract, and because we have seen that this is useless, okay, so this is what is happening. So if we just chomp bite on it and swallow, the saliva washes on it, the entire nicotine becomes useless. So instead what we do is this chew park method. So first we chew and then park. So first we chew, we get a peppery or a tingling sensation that emerges, which is the sign of activation of the nicotine. Okay, so this is the activation of nicotine. Once it's there, we park it. Okay, we don't chew it further. We just allow the buccal mucosa to passively absorb the medication straight into the bloodstream, bypassing the liver. Okay, so from here, this gets absorbed into the mucosa and then ultimately in the brain. Okay, instead of going into our esophagus. Okay, so it goes directly into the brain, and we see the effects. So that's why whenever we prescribe some patient, we need to describe the chew and park method, and park and chew method, whatever you like to call, and so that the patient can actually use this technique instead of chewing it all the way and all of it getting washed through the saliva. Okay, so thank you. Hope you have learned something through this question answer discussion. We will see in the next rounds.